Brianna. I am a student nurse from UTEP, and I'm going to be performing a head-to-toe assessment on you. Is that okay? Okay. Do you have any chronic illnesses?
No.
Any past or recent surgeries?
No.
Okay. Do you have any treated or untreated injuries?
No.
Okay. So I'm going to tell you 3 words, and then I want you to remember them. I'm going to ask for them later on in the assessment, okay? So the 3 words are Monday, Tuesday, Wednesday. Can you please state your name and your date of birth?
I'm in Rubio and April 30th, 2001.
Any allergies to food, latex, to the environment?
No.
Patient appears appropriate for stated age. Patient posture is erect and upright. And then patient is also dressed appropriately for the situation. Are you married or are you any significant others?
No.
Do you work?
Yes.
Okay. How often? How much do you sleep more or less every night on average?
5 or more hours.
Do you exercise?
Yes, like 2 or 3 times a week.
So what is your name?
Rubio.
Where are you?
My name.
What is today's date?
The 18th.
And then where are you here?
Just to get a physical. And also physical.
Okay, so patient alert and oriented times 4. So can you repeat the 3 words that I had told you at the beginning?
Monday, Tuesday, Wednesday.
So recent memory is intact. Do you remember what you ate for dinner last night?
Yeah, I sandwich with Chick-fil-A.
Recall memory is intact. Patient appears clean with no abnormal odors. So I'm going to be checking your blood pressure, your pulse, and your respirations. Okay? Can you lift up your shirt for me, please? Sleep. Okay, so your blood pressure, it is 115/7. I'm gonna assess your pulse, okay? Your pulse So I'm gonna go ahead and assess your cranial nerves. I'm gonna go ahead and assess your corneal reflex. So I'm gonna go ahead and shine the light on your eye, okay? So cranial nerve number 2 is intact. I'm gonna go ahead and assess your cranial number 1, which is the olfactory, okay? Can you smell it? So cranial number 1 and number 2 are intact. So I'm gonna go ahead and have two objects. One is gonna be the blunt and then the soft. So you're gonna close your eyes and you're gonna tell me what you feel, okay? So this is gonna be soft and then blunt, okay?
Blunt. Stop. Blunt. Stop.
Can you go ahead and try and open your mouth? Okay. So range of motion is intact with no crepitus upon palpation. Can you say light, tight, dynamite?
Light, tight, dynamite.
Okay. So I'm gonna go ahead and check your pulses. Okay, temporal arteries, cardio pulses, brachial, radial, femoral, popliteal, and pedistalsis and posterior tuberal pulses were all +2. All skin color throughout the body is appropriate and even, no lesion. I'm gonna check your temperature. Okay. Temperature is even and throughout. I'm gonna go ahead and check your hair, okay? Okay. Even hair distribution of pediculosis. So let me check your. I'm gonna go ahead and check your skin trigger, okay? Skin trigger is intact, and I'm going to assess for edema. No edema present. Okay, I'm going to assess your capillary refill, okay? Okay, capillary refill is less than 3 seconds. And we're gonna go ahead and assess for clubbing. By doing the window test, can you put your fingers like this to one another? So no club evidence as evidenced by the window test. So the head is normal cephalic and it is midline to the body. Go ahead and palpate your temporal arteries. +2 bilateral. Okay, so I'm gonna go ahead and assess for cranial nerve number 4, 5, and 7, which is gonna be the trochlear, the trigeminal, and the hypoglossal. Okay. So can you go ahead and say I? Okay. So oral mucosa is. Oral mucosa is pink and well hydrated. No missing teeth, no bleeding gums, and tongue is midline with no lesions. Can you go ahead and move your tongue up, down, to the side, and to the other side? Okay. I'm going to go ahead and palpate for your tonsils. Tonsils are +1. Can you go ahead and smile for me, please? Frown. Cranial nerve number 7 is intact. I'm going to go ahead and assess your neck. So the neck is symmetrical and midline to the body with no obvious masses or lesions. So I'm going to go ahead and assess your lymph nodes, okay? So I'm going to be assessing the periauricular, the postauricular, the occipital, tonsillar, cervicular, submandibular, the supraclavicular, and the infraclavicular. Okay, so no tenderness upon palpation. So I'm gonna go ahead and I'm gonna place my hand, and then you're gonna go towards it. Okay? Can you push your shoulder? Okay. So cranial nerve number 11 is intact with face and shoulder resistance. I'm gonna go ahead and palpate your trachea. Okay? Trachea is midline. Okay, so can you go ahead and touch your chin to your shoulder? And then the other side. Can you look up? Look down. Range of motion of the neck is intact. Okay, so eyes are symmetrical, iris is brown, sclera is white. Can you go ahead and pull your lids down? Okay, so conjunctiva is pink and well hydrated with an abnormal discharge. So I'm going to go ahead and assess the cranial nerve number 3, 4, and 6, which is the ocular, motor, the trochlear, and the abducens by testing the cardinal fields of gaze, okay? So look here. Follow it, but now moving your head. Okay, so I'm going to go ahead and assess for accommodation and convergence. So go ahead and focus over here, and then focus back to the pen. Focus, look back, and then to the pen again. Okay, so accommodation, pupils accommodated and converge appropriately. I'm going to go ahead and assess for the perla. Perla to light and accommodation. And then can you look to the corner? So I'm going to go ahead and palpate your ears now, okay? Okay. Ears are symmetrical and proportionate to the head. Patient has 2 piercings on each ear, left and right. And then no tenderness upon palpation, no abnormal discharge, no lesions. So the tympanic membrane is translucent and intact. So can you please stand up for me? We're going to be performing the Romberg tests. So I'm going to go ahead and place my arms to your side. Put your feet together. So we're just going to be testing for balance. Okay, so just go ahead and just stand. Okay, good. You can sit down again. Okay, so I'm gonna go ahead and assess your nose now. Your nose is symmetrical and midline to the body. Can you go ahead and look up for me? No lesions or abnormal discharge and no polyps, okay? So I'm going to go ahead and do the rest of assess your anterior and posterior thorax. Okay, thorax is symmetrical and cone-shaped, and there are no lesions. Can you go ahead and we're gonna assess the A&P ratio. So you're gonna measure from your shoulder to your midline right here. Go like this. And then like this. And then go like this. Okay. So A&P ratio is 1 to 2. Okay, so I'm gonna assess your chest expansion. Okay, so I'm gonna place my hands under your chest. Go ahead and breathe in. Breathe out. Okay. So I'm gonna go ahead and. So chest expansion is symmetrical. I'm gonna go ahead and auscultate your lungs now. I'm gonna place it under your shirt, okay? Breathe in. Breathe out. Breathe in. Breathe out. Breathe in. Breathe out. So I'm gonna check that now your front lungs, okay? Breathe in. Breathe out. Breathe in. Breathe out. So vestibular breath sounds were heard with no adventitious breath sounds in the anterior and posterior thorax, regular rate and rhythm. So I'm gonna go ahead and palpate now. Let me know if you have any pain or tenderness, okay? So no tenderness or masses upon palpation. So I'm gonna go ahead and assess for JVD, jugular vein distension. So do you mind laying down with me, please? Okay. I guess the pillows, please. Just look up. Okay, you can sit up now. So negative for JVD. I'm gonna go ahead and assess your cardiac pulses. Okay, cardiac pulses +2 bilaterally. So no pulsations nor visible heaves. So I'm gonna go ahead and assess for your palpate your apical pulse at on the left midclavicular 5th intercostal space. Okay, can you lay down, please? Okay. I'm gonna go ahead and assess for the herbs point. So it's gonna be the 3rd intercostal space, the left sternal border. Okay, S1 and S2 auscultated with no extra hard sounds or no murmurs. Can you sit down again? Okay. Can you go ahead and lay down again? I'm going to go ahead and do an abdominal assessment now, okay? I'm going to lift up your shirt, okay? So, no visible scars, no visible pulsations. Abdomen is symmetrical. Okay, I'm going to go ahead and auscultate your bowel sounds now in the four quadrants. okay? Bowel sounds auscultated in all 4 quadrants. I'm going to go ahead and do a light palpation now, okay? So let me know if you have any tenderness. No tenderness or masses upon light palpation. I'm going to go ahead and do a deep palpation now, okay? Let me know if you feel any pain or tenderness. So, no tenderness or masses upon deep palpation either. I'm going to go ahead and assess for rebound tenderness, okay? So let me know if it hurts more when I push down or when I let go, okay? Okay, so rebound tenderness is negative on any quadrant. So we're going to go ahead and assess your musculoskeletal now. Can you please sit down? Posture's upright and erect. So I'm going to go ahead and ask you if you can walk for me, please. Walk 2 and then back for. Okay. Gait is steady and body is symmetrical, no obvious abnormalities. Okay, so I'm going to go ahead and palpate your shoulders, elbows, and hands for tenderness. Okay, let me know if you feel any pain. Okay. And then I'm also going to palpate your necks, hips, your legs, hip, and knees and ankles for feet tenderness. Okay. Any tenderness? So I'm gonna be go ahead and test the range of motion for your joints. So can you stand in front of me here, please? So go ahead and do like you're swimming. So like this. Good job. Any pain? Mm-hmm. Your elbows, go ahead and go up and down. Hold them. And then your wrists. So go ahead and go up. And then go down. And then go ahead and do your fingers to your thumbs. Okay. So range of motion to all upper extremities are intact. So I'm going to go ahead and do your range of motion now for your lower extremities. Can you lay down for me, please? Okay. So go ahead and do your toes like this, like out, and then in. Okay. And then bring your knee to your chest. Now the other one. And then your ankles, you're going to go ahead and away from your body, and then, okay. So range of motion of lower extremities is intact. Okay, so I'm going to go ahead and apply resistance to your feet, okay? Go up. Go down. So strength is 5 out of 5 to upper and lower extremities. Can you go ahead and sit down for me, please? So I'm going to go ahead and palpate your spine for any tenderness. Okay, let me know if you feel any. So spine is S-shaped with no deformities and no tenderness upon palpation. So I'm going to go ahead and assess the range of motion for your cervical and for your lumbar, okay? So can you do washing machines? Washing. And then can you stand up and touch your toes? Okay, range of motion for cervical and lumbar intact. And then we're going to go ahead and assist for the reflexes. Okay, can you take a seat? So when I'm going to go ahead and palpate your reflexes, okay? And then on your... Okay. plantar reflex on both feet. Do reflexes in bilaterally, and then I'm gonna test for the Babinski reflex. Okay. Okay. So that concludes my assessment. Any questions?
No, thank you.